The ICH Q3E Guidelines in inhaler product. So listen carefully for the packaging regulatory stuffs QCQA people. Very important. The ICH, that is Q3E, the guidelines provides a harmonized risk-based frameworks for ascertaining and controlling extractable and leachable. This is the most, that is important factors for the product. Impurities in drug products including inhalers, that is it emphasizes, that is identifying, quantifying and controlling leachables to enter patient safety, ensure to do, that is when it will, that is whether it is affecting, or that is influencing the product or not, it depends on, that is quantify, that is controlling the leachables to ensure patient safety consistent with ICH Q9 risk management. So these two factors, the ICH Q3E, that is guidelines, that is it contains ICH Q3 risk management, how far that is your, that is human body can intake, or the risk factor is not involved, that is depends on 0.15, that is microgram per day, that is one by one point, risk factors involved, one by one points I am going to explain. High risk applicability. Inhalers are high risk as the medication is delivered directly to the lungs, that is necessitating a comprehensive assessment to device container interaction. Since this product is inject, that is it is going directly in your body, in your through the nose or mouth, especially in the mouth, inhaler mouth. So it is very very important, that is you have to first check the risk factors of this product, whether with the packaging material. Risk based assessment, how it that is you will carry out these guidelines, that is requires identifying potential leachables, that is what are the potential leachables that is really affecting the product, we have to identify, that is during testing. The ascertaining their toxicological risks and controlling them based on their impact on product safety, quality, and efficacy. Three factors. When you will carry out the toxicity test of the product, that is three factors is safety, quality, and efficacy. The most important things. Analyst, that is the product analyst I am talking about. You have to always keep in mind three factors. That is when your toxicity is concerned: safety, quality, efficacy. Life cycle approach, how you will control this, how you should be aware. Extractable and leachable evaluation must be embedded throughout the product life cycle, with particular emphasis on, that is reassigning risks following post approval changes. That is mean, what are the changes? That is changes in material, suppliers, and manufacturing process. You should be very very careful, that is before change your existing supplier. So if you change the existing supplier, mean you have to take the sample fast, carry out the testing in thoroughly, you have to match with your previous, that is data and everything. If it is match, that then you can go through. Then analytical and safety ingredient, that is integration mean, analytical and safety integration, it encourages close collaboration between analytical chemist and toxicologist to establish threshold for reporting and safety qualification. So in this situation, analytical, that is toxicological, that is people's analyst and analytical chemist has to work together, they has to collaborate and understand, then they will study the report and take the conclusion whether this material is really is good enough to manufacture the product. Comprehensive scope mean the guidelines covers organic impurities from materials, devices and packaging, while that is specially excluding inorganic, that is elemental impurities, which are covered under ICH Q3D. These guidelines is currently under public, that is consultation. Following steps, that is I already explains, that is aiming to streamlining global regulatory requirements. So, in brief, you understand how that is ICH Q3E guidelines, that is contains, that is high risk applicability. I explained risk based assessment. What are the risk factors that is involved in inhalers? Then life cycle approach explained, analytical and safety integration, analytical chemist and toxicological chemist, how they will work together and take the decision whether after, that is by looking at the final test results, whether it is really it will work this incoming material, so or not for the product. And also comprehensive scope, what are the scopes available for this testing of this material. Thank you very much. Like and subscribe for more attractive videos. Thanks.